everybody, welcome back to my channel. I came in to see Sarah today from the dental surgery Clifton, and she's actually a dentist as well as you do aesthetics, right? Is it esthetician? Is that the correct term?
Facial esthetician, dentist with special interest in beauty treatments.
So I feel a little bit more comfortable doing this with her because I know she has more of a medical background, and I mean, when it comes to your face, you kind of want somebody that's knowledgeable in what they're doing, wouldn't you say?
Knows their anatomy.
Yeah, exactly. So with that, I thought I would bring you guys along for this consultation, and then if you think everything's a-okay and we're on the same page, maybe I can get treatment today.
Yeah.
Sweet.
Sure.
Cool. Awesome. So walk me through your consultations.
Already filled out medical form and fit and healthy.
Yep.
No allergies.
Penicillin.
Yeah. Not related, so that's a good thing. And I just need to talk to you about what you want, what bothers you.
So you guys, I have, I can't do it
She
now.
mentioned it.
We did mention this before, but I feel like I have this this Wi-Fi symbol like right here that drives me mad. If you guys have been following along on this channel, you would have seen that I just did a commercial, and there's one part in the commercial where I like pull out my hair and I look at it, and all I see is the Wi-Fi symbol, and it drives me mad. So how do we go about sorting that out?
So my aim in treatment is always to make the patient look natural.
Yeah.
I don't want you to have a frozen look, and with your job, you want to have some expression on your face. So you move a lot, that's not a bad thing, and you want to keep some movement, but you don't want the wrinkles to become there when they're static, which means they're deep lines. When you wake up in the morning, you're not even moving your face, and you can see them. Those are difficult to treat. You're quite young, so looking at you, you are, and I can't see the lines if you're not moving your eyebrows, which is a good sign. So the anti-wrinkle injections will work. What they will do is they stop the muscle from moving for 3 to 6 months. Everyone's different. If you do move a lot and you've got a lot of lines, it can wear off quicker. There's something called toilet training, so some people still are moving the muscle even if you don't see it moving. That makes the anti-wrinkle injections wear off quicker. So I always make sure that my clients know that it doesn't last a very long time, and the more you have it, the more shrinkage you get. The muscle atrophies, so it becomes smaller, so the top-ups are less frequent with time. Have you ever had treatment before? Have you ever had Botox done?
I've had it done once, but I got it done, it was a few years ago, so I didn't have this problem area. But yeah, I didn't notice that it wore off super fast, but I do think that I'm a really expressive person, so I'm sure we'll see.
So it's a good thing. The thing is some people, we have to respect the patient's wishes. So do you want your face to be frozen, or are you happy with having some movement?
I would like to be in between. So it's like, I do think I would like not to be fully frozen, but like more frozen than not frozen at all.
Good answer.
I just think I am noticing my makeup settles, and I know these are like little things for me, but I have a job where I'm constantly looking at myself, and I just hate that I'm starting to see it. So yeah, I don't know if that answers it.
Makeup lines, yeah. So perfect candidate for that. You're realistic with your expectations, which is quite good for both of us. So I don't want you to come back saying my face still moves. And then we're gonna have to top you up maybe. Everyone is different, so we use standard dosages, and then after 2 weeks, when the full effect kicks in, we assess again and we see if you need more. You might be happy with it, or top up is fine, but we have to wait for 2 weeks for it to work. You might find that between those 2 weeks, your face is gonna look funny, meaning some areas will work faster than others. You just have to wait and be patient. 2 weeks, and then you get to see the full effect, basically. Okay.
Exciting.
Side effects. Rarely, you'll just maybe get some bruising, but we use a needle for every area, so the bruising is minimal. You might get a headache. Some people do get headaches, some people don't. If you do, it's just headache where you've had the treatment done. Paracetamol over the counter. Painkillers, just take that for a few days until it wears off. And yeah, that's really it for side effects. It's there's nothing really concerned with it. Filler is another story, but
we'll get to that. Okay, cool. Sweet.
Do you have any questions?
I mean, no. You told me how long it's gonna last for. You told me how long I can see effects. I'm not gonna die. Okay. We're gonna get rid of this somewhat.
Let's relax those muscles.
Okay, cool. Let's do it.
So you have to keep your face super clean. For the after, I will talk you through the post instructions. Okay. So just some baby wipes, and then I'm gonna go around with alcohol again. Okay.
Okay. I'm really glad I contoured.
Frown for me. It's more of a sad frown. Yeah, it gets tiring. It's like, am I still doing it? And relax. Lift your eyebrows up. So you don't have a lot of crow's feet going on, which is quite nice.
But they're coming.
Yeah, so we want to stop that.
Yeah.
Because Botox is more prevention than actually treating the lines.
This is the first year that I've noticed them there.
Look at me. Scrunch. Do these bother you?
I mean, do they bother you?
Not really. You might frown for me and relax. Now scratch. Frown again and relax. And again. And done. Doing really well. How does that feel? You okay?
The first one was painless. The last two were, you felt it. I think just certain parts of your body is so much more.
So yeah, I find my eyebrows are more sensitive. It's a thicker muscle in the middle, so you don't really feel it. Did you have a lot of coffee today?
No caffeine today.
Okay.
I'll have chocolate downstairs. But...
And frown again. And relax. And deep scratch. And then you're doing really well. And then scratch. So we're gonna do your eyes again.
I feel like these ones hurt, don't they?
These are a bit sensitive just because the skin is really. And a little scratch.
I didn't mind that. The ones in the middle of the forehead. The ones in the middle of the forehead are still stinging.
Yeah. Different feeling.
That is terrible.
Told you. A little scratch again. That one was my least favorite. I would say that you do get used to this pain. It becomes sort of a nice pain.
Oh Lord.
We only have 3 more points. You're not going to fall asleep on me, right?
Oh no.
And another one coming up. 2 more.
That one wasn't bad.
Done.
So we just finished injecting in my forehead, and you also did around here. What do I do from here?
So keeping the area clean is really important. It's areas that have been freshly injected. You don't want to get any infections. So no makeup for 24 hours. Stay away from heat. Anything that's, you know, sun, saunas, exercise. Try to stay away from that. And you might get some bruising. Okay, that's normal. It will go away. And that's it really, so just be careful and keep it clean.
Okay.
And any problems, of course, you can contact me. You might get headaches. If you do, just take some painkillers. It should settle within a few days.
Okay.
And if you do need topping up or want to see me, of course, you're more than welcome, but I do tend to, you know, advise my patients to wait for full 2 weeks for it all to kick in and take its full effect and then assess.
Okay, wicked. Thank you.